Morning, Rochester. El Poder Latino in the Mambo in the Morning Show welcomes you back. It's 9 o'clock, 45 degrees in the city of Rochester, and joining me this morning is Dr. Erica Bostick, and she is from the Cancer Services Programs of the Finger Lakes, and here to talk about HPV education, cervical cancer screenings, and a special project helping uninsured women between the ages of 21 and 39 get access to care. Thank you for joining me this morning.
Thank you so much for having me.
Absolutely. For listeners who may not be familiar, what exactly is the Cancer Services Program of the Finger Lakes, and what do they provide to the community?
Yeah, so we are a New York State funded program that really aims to work with the community to spread the message of cancer prevention. We work with those who are uninsured to provide services for breast, colon, and cervical cancer screening.
Yeah, and it is National Women's Health Week. Is that correct?
I believe so.
Yes. Why is that such an important thing, and why do we need to have this conversation?
Well, I think cancer is something that scares a lot of people. And for cervical cancer in particular, this is a highly preventable cancer. And for the other cancers too, with screening, we can pick it up early and try to have the best conversations to help prevent it from getting to be something bigger than anyone wants it to be. And our program helps spread the message with community-facing education, but also connection to care that sometimes is hard for lots of reasons for people to access.
Absolutely. Dr. Bostick, what is cervical cancer, and why is early screening so important?
Cervical cancer is a cancer that affects part of the uterus. It is very much connected to the human papilloma virus, or HPV, which is something that some people know about, some people don't know about. There's a bunch of misinformation out there too. And not only does HPV linked to cervical cancer, it's also linked to many other cancers. And one of the exciting things about preventing this progression is the HPV vaccine and new and upcoming ways to screen women or people with cervixes to make sure that we know what's going on and we know how to help people.
And what exactly is HPV, and how is that connected to cervical cancer?
So HPV is a type of virus. It is sexually transmitted, and it often kind of goes away by itself. But for those who maybe it won't, there are different types of HPV strains, and many of those are contained in the HPV vaccine, which is recommended for those starting at 11, but as young as 9, and then through up to age 26, and even beyond that if you talk to your provider about it. And so this virus is something that is really, really common, that there might be some stigma around that we're trying to break through and make sure people know about it and how it's related to cancer.
And are there symptoms women should watch out for?
Sometimes there's symptoms, but most often there's
It's
not
silent?
symptoms.
Yeah, really?
And that's kind of what makes it tricky, right? So this can be a sneaky thing, but unlike other cancers, the recommendation for screening to make sure that nothing's going on, and if it is, we're helping you, is starting at age 21. Some recommendations 25, but as early as 21. Unlike the other cancers that typically start at 40. But the Cancer Services Program is able to provide funding for those uninsured to get these screenings as young as 21 and beyond.
Let's talk about fear and misinformation for a little bit. A lot of people avoid doctor visits because of the fear, embarrassment, or sometimes the cost. What would you say to a woman who has been putting off screening?
First, I'd want to hear what the fears are and validate them. I think the medical system as a whole is a flawed one for many reasons. And so what my big takeaway is women and all folks know their bodies best, but sometimes these things it's impossible for a person to really know what's going on, even if you know your body best. And so I would encourage women and other folks with cervixes to really empower themselves, to call us if we can provide support, to connect you and address some of the fears. There's a lot out there in terms of misinformation, and really talking to a provider to get the evidence-based focus and partner with folks to make sure that this is the care that they feel comfortable with.
Now, are screenings typically quick and manageable for patients who may feel nervous?
So for cervical cancer screening, it does often involve a pelvic exam, which is something that can be very intimidating to lots of people. Depending on your age, there are some newer things that are less invasive, like just a quick swab to check for the virus. And so this is definitely a conversation that I think women can feel empowered to have with their providers to know what their options are for screening.
Yeah, sure. And in the Latino community, I mean, especially, sometimes health conversations don't happen openly. How important is education and normalizing these conversations?
So incredibly important. And I think conversations can happen within families, within communities, and with providers. And part of our job as healthcare providers is earning the trust back from the community that might have been broken. And that's something that the Cancer Services Program really feels strongly about and really wants to advance.
Okay. Doctor, tell us a little bit about the special program helping uninsured women between the ages of 21 and 39 receive screenings, and how does that work?
Yeah, thanks for asking. So this is through the University of Rochester. A really generous donor provided funding to the Center for Community Health and Prevention, which houses the Cancer Services Program. And it came from an unmet need for women less than 40. Again, most of the programming there starts at age 40 for colon cancer and breast cancer screening. But cervical cancer screening is a little bit different. And so we were missing a whole bunch of people, and we were able to kind of describe this unmet need. And now we're able to use that funding to deliver the same care that we've been able to link people over 40 with for those 39 and under.
And what qualifies someone for assistance?
So we have our phone number, which I can definitely share with you, and our referral. We partner with lots of community practices too.
Shoot that out there, and then we'll throw it on the screen for those who may be watching this as a podcast.
Let me read the number.
No
here.
rush.
So we have a really nice intake form that some community practices already have.
Okay.
We also have our phone number, and you can self-refer too. And let me pull that up, and I'll tell you the number.
Awesome.
So you are welcome to call us. I'm a little biased, but very, very nice people at 585-224-3070. And you can email us at csp@urmc.rochester.edu. We'd be happy to connect and tell you more.
Awesome. Now, doctor, if someone doesn't currently have health insurance, what should they do?
Call us. We can help you.
There you go.
We are limited in terms of our focus being cancer services programming and prevention, but we can also link you to care and give you some information about other places where you can get primary care immunizations, things like that.
Yeah. And are there services available in Spanish?
Yes.
Awesome.
Yep. Definitely. We want to be able to engage with the community as a whole, and that is not just English-speaking people.
Yeah, absolutely. Doctor, what message would you like to leave with women listening this morning?
I guess I would like to say that trust yourself, but allow the healthcare provider field to earn back that trust and help you prevent cancer in this way.
Absolutely.
And thank you.
Yeah, for sure. Now I'm going to give you a couple of minutes to maybe put out there something that I did not ask you, so
Sure.
Go ahead. And
Yeah. So I think really, I just want to call out that distrust that has been building over time. And I think some people are afraid to just admit it. And I think that's a fundamental first step, and one that we're really trying to build bridges, and we have for a long time. Cervical cancer, again, is a preventable, slow-moving cancer, and it's just heartbreaking when people wait for symptoms or, feel alone out there and then eventually come to care. And so I just want to empower the women out there to take charge of their bodies as they are in so many other ways, and invite you to learn more about cervical cancer prevention through CSP.
Absolutely. Before we wrap things up, what would you say is the biggest myth of cervical cancer?
I would say it's more around the vaccine that prevents cervical cancer. So the HPV vaccine is a long-studied vaccine, very, very safe and very, very effective in preventing not only cervical cancer, but different types of cancer like head and neck cancers, anal cancers, other cancers. And so there's just a lot of vaccine misinformation out there, and I would just encourage the community to talk with your provider about what's myth and what's fact and what we don't know, because there's plenty we don't know as well, and we need to own that too.
Absolutely. Well, again, thank you, Doctor, for joining us here on the Mambo in the Morning Show. We definitely appreciate your time and everything you do for our community.
Thank you.
These conversations are important because early detection saves lives. So if you, someone you know, has been putting off screening because of cost, fear, lack of insurance, please know that resources are available right here in our community. For more information, you can reach out to the Finger Lake Services Programs of the Cancer Services Programs of the Finger Lakes. Kind of a long title.
It's very
there.
long. Very long.
but that's it right there. Cancer Service Program of the Finger Lakes. For more information, you could reach out to them. Once again, Doctor, thank you so much for joining us.
Thank you.
Hope you have a great day.
You too.